Addiction is everywhere. Whether it's through substance use like taking drugs and alcohol, or something more behavioral such as checking your phone constantly or vaping, many of us are addicted to something. Addiction is mainly associated with hard substance use. However, more recently, the scope has expanded to include wider behaviors such as gambling, social media, and even eating. When an activity becomes detrimental to a person's everyday living or productivity, we can deem that as addictive behavior. Understanding the underlying mechanism of addiction is crucial to shed light on and how it affects the brain. According to experts, the brain can change with addiction and that it takes a lot of work to get the brain back to its normal state. This is exactly why we need to be wary of how addiction works, so we can aim to prevent or deal with it properly. Before we go on with the video and talking about addiction and the brain, please subscribe to this channel as it helps us out and spread more information on brain, behavior, and business. So, people often view addiction as an unwillingness to stop the engagement of a given behavior. We see addicts as having little to no self-control, putting the blame on them. But when exploring the nature of addiction itself, there is much more to it than just simply wanting to seek pleasure without constraint. More experts are now beginning to take note that the desire to escape discomfort, both physically and emotionally, may be the very reason why people engage in addictive activities. And beyond just an unwillingness to quit something, addiction is a chronic disease that hijacks our brain and affects its overall structure and function entirely. Due to the fact that addiction is a genuine sickness, we need to treat it. As such, there is what is called the syndrome model of addiction, as written by Schaefer and Moore. This is a theoretical framework that suggests that there is one addiction associated with multiple expressions instead of the traditional notion that there are multiple addictions. This idea that there are multiple expressions of a single addiction implies that we can all inherit or accumulate different influences and experiences over time across our life, can inevitably increase the likelihood of addiction, because at the end of the day, it's all just different ways of expressing it. With this theoretical model of looking at addiction as a syndrome, there is a heavier emphasis on the person and the relationship with the object of addiction. Now, an object of addiction can be anything, whether it's a drug or a specific activity. If that object of addiction influences or shifts that person's experience to feeling good to better, they are more likely to become addicted to that given thing. According to a study, the power of addiction lies in its ability to hijack and destroy key regions of the brain that help a person to survive effectively. Addiction can alter the brain's reward circuitry, which exists within the limbic system. The reward circuit includes areas involved with motivation, memory, and pleasure. The addictive substances and behaviors, there is excess stimulation to the circuit, which then overloads it. To give some perspective on how this works, when it comes to a healthy individual, the brain rewards positive behaviors, exercise or doing something productive, by switching on brain circuits that make the person feel good. This rush of dopamine then motivates the individual to repeat said behaviors. Furthermore, when in danger, a healthy brain will alert a person with feelings of fear as a way to help the person get out of harm's way. The prefrontal cortex can also assist in higher level thinking to make better decisions, weighing whether the consequences of an action are worth it. All of this changes, however, when you become addicted to something. The normal hardwiring of the helper brain processes start to work against you. Things like drugs, alcohol, and other addictive behaviors and substances hijack the pleasure or reward circuitry of the brain, hooking the individual into wanting more. The reward and motivation circuitry is scrambled to the point where self-care behaviors are replaced with more detrimental, addictive ones. Addiction can also send the part of the brain that helps you get out of harm's way into overdrive, thus making you feel anxious and stressed, even when not taking any substance or doing said addictive behavior, such as scrolling through the phone mindlessly. As a result, people do their behavior to make themselves feel better and alleviate anxiety. According to Dr. Nora Volkow, brain imaging studies of the prefrontal cortex of people addicted to drugs or alcohol show a decrease in activity in the region. This means when it comes to decision making, they are in a way stunted, and as such cannot make proper high-level decisions to stop and or think about long-lasting consequences. In the end, addiction is now understood to be a disease. Whether it's with alcohol, drugs, sex, or even something seemingly innocuous like scrolling through social media, overcoming an addiction isn't as simple as just trying to exercise greater control over our impulses. Addiction develops when the pleasure circuits in the brain get overwhelmed. That can become chronic and thereby turn permanent. Addiction can also cause issues in focusing, learning, and remembering, as well as decision-making and judgment. Unfortunately, the belief that addictions are simply a bad choice, which in some way it is or starts off that way, can be taking the severity out of the matter of addiction in general. Using words like junkie or lazy creates bigger issues with how a person may feel about themselves, creating more anxiety that induces even more addictive behaviors. It ultimately creates challenges in finding ways to treat the addiction itself, and often in our society, searching for solutions like therapy is not yet normalized. For this reason, we need to start thinking and talking about addiction in a different way. And in doing so, we can learn to treat it in a much more efficient and effective way. To learn more about pleasures and pain systems within our brain, watch the video on the left. Please make sure to subscribe to this channel so that we can continue to help you mind the goal in mind.